Hi and welcome to my channel. Today, we're going to dive into 10 multiple-choice questions about basic physiotherapy. Let's get started and test our knowledge together. Question number 1. Choose the false statement regarding to the ankle and foot. A. The tibialis posterior muscle is the prime supinator of the foot. B. The plantar fascia of the foot provides a passive support to the medial longitudinal arch. C. The 0-degree, neutral, position at the talocrural joint is defined by the foot held at 60 degrees to the leg. D. Because the lateral malleolus is inferior and posterior to the medial malleolus, the axis of the flexion, extension, departs slightly from a pure medial, lateral axis. And the correct answer is C. The 0-degree, neutral, position at the talocrural joint is defined by the foot held at 60 degrees to the leg. Question number 2. Choose those structures which are elongated at the end of plantar flexion. A. Posterior part of the capsule. B. Plantar flexor muscles. C. Ligamentum talofibular posterior. D. Tibionavicular part of the ligamentum deltoideum. And the correct answer is D. Tibionavicular part of the ligamentum deltoideum. Question number 3. Choose the correct statements related to the articulatio calcaneocuboidea. A. This is the lateral component of the transverse tarsal joint. B. It is built up by the distal articular surface of the calcaneus and the proximal articular surface of the navicular bone. C. This is the medial component of the transverse tarsal joint. D. It is built up by the distal articular surface of the calcaneus and the proximal articular surface of the cuboid bone. And the correct answer is A. This is the lateral component of the transverse tarsal joint. And D. It is built up by the distal articular surface of the calcaneus and the proximal articular surface of the cuboid bone. Question number 4. Muscles with eversion and extension action at the ankle and foot. A. A musculus peroneus longus and brevis. B. Musculus tibialis anterior and musculus extensor hallucis longus. C. Musculus tibialis posterior, musculus flexor digitorum longus and musculus flexor hallucis longus. D. Musculus peroneus tertius and musculus extensor digitorum longus. And the correct answer is D. Musculus peroneus tertius and musculus extensor digitorum longus. Question number 5. The open-packed position of the knee joint is A. Hyperextension. B. The full extension. C. The full flexion. D. 25 degree of flexion. And the correct answer is D. 25 degree of flexion. Question number 6. Choose the function of the lateral collateral ligament. A. It resists varus angulation. B. Provides restraint to anterior sliding of the patella. C. Provides restraint to axial rotation. D. It resists valgus angulation. And the correct answer is A. It resists varus angulation. Question number 7. Functions of the collateral ligaments are A. Provides resistance to the internal and external rotation in neutral position. B. Limit excessive knee motion within the frontal plane. C. Primary stabilizers of the knee joint within sagittal plane. D. Provide screw-home mechanism during extension. And the correct answer is B. Limit excessive knee motion within the frontal plane. Question number 8. Choose the one right answer. A. The patella acts as a spacer between the femur and quadriceps muscle, which decreases the moment arm of the knee extensor mechanism. B. Fibers of the vastus lateralis help to balance the lateral pull of the patella by the quadriceps muscle as a whole. C. Compression force and area of the articular contact on the patellofemoral joint decrease with knee flexion. D. The oblique fibers of the vastus medialis help to balance the lateral pull of the patella by the quadriceps muscle as a whole. And the correct answer is D. The oblique fibers of the vastus medialis help to balance the lateral pull of the patella by the quadriceps muscle as a whole. Question number 9. Choose the false statement regarding to the meniscus. A. The medial meniscus has an oval shape. B. The lateral meniscus attaches to the tendon of the popliteus muscle. C. The external border of the medial meniscus attaches to the deep surface of the lateral collateral ligament and adjacent capsule. D. The lateral meniscus has more of a circular shape. And the correct answer is C. The external border of the medial meniscus attaches to the deep surface of the lateral collateral ligament and adjacent capsule. Question number 10. The Q angle refer to A. The overall lateral pull of the biceps femoris muscle relative to the patella. B. The overall medial pull of the quadriceps femoris muscle relative to the patella. C. The overall lateral pull of the quadriceps femoris muscle relative to the patella. And the correct answer is C. The overall lateral pull of the quadriceps femoris muscle relative to the patella. Thank you so much for watching. Hope you enjoyed the session. Looking forward to seeing you in the next video.